Buonasera, grazie Fabio.
Good afternoon. Thank you, Fabio. I would like to welcome you, of course, on behalf of the staff of the observatories, on behalf of Professor Corso, who should have been here today, but due to previous engagements, he couldn't join us today. So, of course, I'm also speaking on his account, and I'll try and do my best in terms of synergies between us. The objective,
Tecnologia in mano.
the objective, as Fabio said, is to provide a very brief summary, given the time available, of the things that are occurring in the field of healthcare. Mrs. Gilardi gave us some hints on the guidelines from the ministry, so a top to bottom snapshot. Now we're trying to see it from bottom to top. Briefly, the observatory, well, it was set up 4 years ago, as
Già dal primo anno
Fabio said. From the very first year, we really cooperated closely with IOP Giovani to enhance the mutual experiences and then transfer them within the healthcare establishments. The goal is, in agreement with the other observatories, to analyze and see how innovation is changing and evolving into the healthcare establishments and institutions, with the objective of promoting the dialogue between the operators, demand and supply, operating in this market, the healthcare market. Our ambition is to be a reference point for decision makers at all levels, ministerial, regional, and so on, within the healthcare domain. So I would like to show you a few of the slides we used in our presentation, because the research is an annual research that ends in the organization of a conference. It's depicted on this slide on the left-hand side, and results are turned into an online report. Some of the results are also published in specialized magazines, and we have also organized an award for ICT. And thanks to the cooperation we have with IOP Giovani, we would like to launch this initiative, as your chairman reminded us, also in the field of IOP association. The objective is to cast light on the most significant experiences made by the various hospitals or the municipality, and of course confirm the value of the initiative and award the best one, the one which meets our criteria. Moreover, the observatory monitors an online community in order to create connections with the various actors, the ICT experts, the CEO, the strategic managers of hospitals. These are, again, very quickly, the main themes, part of our research. Of course, we relied on the precious cooperation of healthcare companies, hospitals, and other institutions, and among them IOP. The objective:
analizzare dinamiche di spesa.
Analyze the spending attitude in terms of ICT. So I will also corroborate this with further data to integrate with what Martin said, entering into the merit of the spending items. We also analyzed where such investments are allocated, where in fact such amounts and investments are allocated by the companies. to verify whether they share a common trend. Then, again, very briefly, and in a provocative manner, of course, being positive, we also verify whether there are correlations between effectiveness, efficiency of hospitals and their investments into the ICT. Well, in this case, we made a big step forward to demonstrate that a huge contribution in the improvement of the quality level, as Martin reminded us, an improvement of effectiveness and efficiency is given by ICT investments. And then, in the light of the outcomes, the outcome of 4-year research, again, we were kind of provocative in our approach, because one of the most critical elements that, in fact, we found in terms of ICT investments in healthcare is the issue of governance. Who is the one who leads investments, who channels investments so that they may answer to strategic needs like the ones decided by the Ministry of Health, for instance. This is just an overview of the research method, how we can read data. As a source of data to be processed, we use an e-questionnaire, an e-survey that is then integrated with case studies. Here you see them. The number of companies involved, their input. In particular, we delivered 105 questionnaires to the CEOs and 134 among general managers, administrative managers, and the healthcare manager. We also analyzed regional trends, the 6 regional trends. The advisory board is the scientific committee where some of the healthcare institutions sit, our partners supporting the research and sponsors, and among them IOP.
Ecco, vediamo un momentino alcuni numeri. Prima.
A few figures. This is how our 177 companies has been broken down by type of structure and their legal status, private, public, geography and size of the company. As far as the type of structure and juridical status or legal status of the sample is quite significant. It is less significant with regard to the geographical location. In fact, we have more respondents in northern areas, much less in central Italy, even though actually the number of hospitals in central Italy is quite high, and a bit more, of course, less than in other regions in southern Italy and the islands, while vis-à-vis the overall population, we see the large and medium-sized companies prevail. This is a summary of the spending categories, meaning investments, capital expenditures made between 2010 and 2011. Colors show the number, 0.25 million euros, etc., up to an overall spending, in percentage not so relevant, of companies spending more than 5 million euros in ICT. As you can see, there are a couple of clusters here. There is a sort of a fragmentation around the line between 1 million and 2.5 million euros. 50% of the companies in our sample spend less than 1 million euros, and about 40% of companies that exceed the threshold from 2.5 million up. If we then analyze these two clusters and their main components, we can draw some conclusions. Clearly, companies spending more in ICT are hospitals and the ASL, so the local healthcare system centers. Private companies, of course, are among those hospitals that spend less in general, less than 1 million euros. With regard to, and we will find, of course, the same data elsewhere, the biggest spending entities in ICT can be found in northern Italy, as I said. Now, thanks to statistical assessments that try to support this lack of uniformity in our sample, and that through statistical data we were able to turn into a significant sample. So we estimated that overall the budget of hospitals in Italy is around 920 million euros. Well, this is not the overall ICT spending, because to this value we should add the ICT budget of the regional authorities. We know regional authorities have their own budget, and they, of course, integrate and increase the ICT spending of the various hospitals and companies. Moreover, we have to increase the investments or spending of all those initiatives that start from the ministry. And furthermore, we have to add to this the expenses made by the individual lab. Let's think of the non-relevant ICT investments. However, the number boils down to a huge amount of dentists or many other specialties and so on and so forth. So we estimate about 1,200–1,300 million euros. So this amount, compared with the healthcare investments to the national fund, which is 114 million euros, this year, at least in 2010, the Corte dei Conti verified that it decreased by 1 billion euros, to the great satisfaction of the Minister of the Economy, Mr. Tremonti. We get to 1% or a bit more overall vis-à-vis the overall national spending in health care system. If you look at the how this spending is broken down by geographical area, this amount, well, accounts for 38% in Northwest, 17% Central and Islands, 19%.
Se normalizziamo,
if we standardize all this data vis-à-vis the number of inhabitants, we would find that while the Italian average is 15 euros per citizen, 60 million Italians, 120 million euros spent, well, we see that the geographical position has its own value, because in the northern and western region we have 22 euros spent per citizen, then we fall to 9 euros per citizen in hospitals located in southern Italy and the islands. The ratio in this case is a 1 to 1, 1 to 1.5, which is something which is a reflection for us. Now, if we analyze the shares of incidents in terms of overall national healthcare system spending, we find this. That is approximately 50%, so the Italian average is around 1%. Then there is a negative gap vis-à-vis the European average of about 0.5%. In fact, a study made by Deloitte Consulting in 2006 in fact, says more or less the same. So we used this study for our own benchmarking purposes. So we see that in Europe, 50% approximately of hospitals spend more than 1.5%.
Delle situazioni molto.
If then we consider the individual situations, we find that, let's say, in the Netherlands, 60% of hospitals spend more than 3%. Well, another piece of information I take from the report, let's take France. France, 43% spent more than 1.5%. I mean, we reached 22%. Actually, there must be a gap. There is a gap. We don't know whether we spend correctly or not. Overall, this research says that we spend an amount which is very, very low, the tailgate, so to speak, of the European average.
Gli investimenti.
Let's see where such investments are allocated in terms of priority list. What we asked to the ICT manager who answered our questionnaire is, which was the average investment level in the past few years in the following fields? These are the fields where we think the ICT can represent innovation, process innovation, and overall innovation. Now, you see, the lion's share is made by investments in patients' records and investments in the administrative area. We also asked our managers the possible trend in terms of average future investments. And this is the distribution. The only area where a decrease in investments is estimated is the administrative management. This can be explained in various manners. For instance, the administrative area is quite a consolidated one, so you won't invest if not for replacement reasons. The 3 digits investments are domains of electronic billing operations plus 139%. Apparently, this type of domain, this type of innovation, process innovation, is now part of the interests of the hospitals, but this is a trend yet not fully consolidated. And then
è abbastanza significativo nel dire che si sta avviando in maniera sempre.
And then we have what in Italian we call conservazione sostitutiva, the replacement conservative or conservative replacement, and which refers to the issue of dematerialization, which involves all the initiatives, and so on and so forth. For those, of course, who are interested, of course, I'm not going to go into the details because there's no time.
Come dicevo,
as I said, when I started, we tried to make a sort of game. We reported on a matrix the positioning. On the y-axis we have the public current per capita spending, the proxy of efficiency, even if it is not fully. And on the x-axis we see the indicator of effectiveness, using as a proxy element the, well, you can see it there, I mean the perception of citizen on the performance of medical care, hospital care received. This is a proxy element.
So we obtained this map. So as you can see in the top part here, when assessing with a rather positive assessed by users, we have mainly northwestern regions and northeastern regions. Slightly lower, we have central region and southern regions and islands. So quite quickly, here we have grouped according to clusters the positioning, and as you can see, we have plotted here the costs per citizens. So on the top part we have spending, which is higher in ICT. Now, without too many remarks, there appears to be a certain type of correlation with the investment in ICT. The last point we touched upon, and that gave the title to our conference, which is that innovation, looking for an author, comes from my 4 years of experience on the field, and resulting also from an in-depth analysis that we carried out together with our partners, therefore by examining their positive and negative experience. We cannot deny that there is an intent to innovate in the health sector, but very often there is a governance which is quite widespread, also for its organizational model. So what today we can see that when interviewing different organizations, that we lack resources and competence. What we see and the concept of the iceberg, and that we consider to be one of the main elements to a drawback to this dissemination of ICT, is this fragmentation of governance at the different levels. They cannot, in a certain sense, directly drive investments, and on the other, favor a dissemination of positive experience. And finally, the question, who will be the author? And then it's the future will only tell.